So I thought this is good for all of us, because even if we don't have SI joint pain, considering 75% of women get it at some point in their lives, it's good to be preventative. And I've been really focused on alignment now. And it's very easy to get the hips out of alignment when we do yoga, especially fast, right? Something will torque. And so I'm really focused about, everything I do now, keeping those hips squared and aligned. So it's, I'm not standing like this, which is how I love to stand. Here's a skeleton. So here we have the back of the skeleton. This is your sacrum here. Hold on. You see this triangle here? And it has nerves coming out of it, right? So that triangle is your sacrum. Here's your tailbone, right here at the end. And most of us can feel our tailbone. If you go right under your bum, you can feel where your tailbone ends. All right, so this is a triangle. It's called the sacrum. It ends in the tailbone. It attaches to the iliac crest. So you can feel your iliac crest here with your hands, and then it goes down here, and then the sacrum attaches to it. All right, so let me see. So the ilium bone here attaches to the sacrum, and there's a ligament in here that attaches. So bones need ligaments to attach to other bones, right? Tendons attach muscle to bone, ligaments attach bone to bone. So with SI joint pain, the ligament gets overstretched a lot of times, and I overstretch mine, I'm sure, from doing spinal twists too aggressively and being assisted by yoga teachers into an even deeper spinal twist. And after 5-6 years of those heavy duty assists, I overstretched my ligament, I'm pretty sure. And then my quadratus lumborum, the tendon. Quadratus lumborum is a small muscle that attaches from this iliac crest. I can feel it here, and it goes up here and attaches to a rib. And so that tendon got overstretched, my ligament got overstretched. Once these tendons and ligaments are overstretched, there's not a lot we can do to unstretch them. But what we can do is stabilize all the muscles around them so that we don't further stretch them, and that we can not irritate them by stretching. So what we're doing, I'm revisiting this class because I think it's so important, is to stabilize all the core muscles around this area. So we're going to stabilize the psoas muscle, right? This is the muscle that allows us to walk. It can get very tight also. We're going to work on the quadratus lumborum here, the glute medius at the side. We're going to work on the adductors, which squeeze our legs together, and the abductors, which pull our legs apart. And then the transverse abdominis is the deepest stomach muscle we have. It's like a girdle that goes all the way around, and it stabilizes us. So we're going to work on all these muscles, get them nice and strong so that we have a stable core. But we're also going to do some stretching. So the idea is we're going to strengthen the muscle, then we're going to stretch it, and then we're going to strengthen another muscle, and then we'll stretch it. The problem with yoga is we tend to love the stretching too much in yoga because that's what feels good. We release a lot of endorphins when we stretch, and I don't know about you, but I tend to prefer stretching over strengthening, but I'm going to reintroduce a little more strengthening into the yoga classes, because the truth is we need a balance, and if we focus too much on stretching, we put the joints, we lose stability in the joints. So we need to work in teams, in pairs here with strength and stretch, strength and stretch. So that's kind of the theme of the class. All right, so it's going to be very similar to last week, but some people are away last week, but also I think that sometimes we have to do something 2-3 times before it really lands. So that's why I want to revisit it. We are going to need 2 blocks if you have it today. If not, you can somehow manage with 1 block, that's fine. Or if you have 2 books, hardcover books this size. If you have a small hand towel, you might need it. You might need it for your knees. You might need it if you have an uneven torque. Sometimes putting a towel behind one hip will help, so you might need this towel. It's nice to put over your eyes for Shavasana. And then we always have our strap, right? So we'll have that in front of us also. All right, so today what we're going to do is we're going to start our time in, but I'm going to ask you to put a block between the knees and bend the knees. And make sure the hip bones are alive. And this is just mildly waking up the adductors, the thigh muscles that squeeze in. Very mild. I don't want you to squeeze the block, but you have to squeeze it enough so it won't drop. And then the arms can go either in cactus pose or A-frame, however you want, or on your body. That's completely up to you. Also, with the knees bent, it can feel way more soothing for the lower back. So that's the other reason to do bent knee time in. Let's just land in this class, making the transition from your morning activities to this new activity of a yoga class. Maybe sighing a little. And so I thought maybe we would focus on sounds today, since I have a lot of bird action in my backyard and you might also. So perhaps we can do a sound anchor. What that means is that we're just going to take a few inhales and exhales and just see if there's any sounds that percolate from our environment, or maybe the sound of your breath. And then you might notice that the mind wanders. And if it does so, just maybe coming back to the sound anchor once again, noticing if your environment is providing you with sounds, and it might be the sound of silence. Today we're going to, for the breath, I'm going to ask us to focus on 2-part inhales and 2-part exhales. So let's do a few practice rounds right now, because I'll be asking you to do that throughout the class. So we're going to inhale 3/4 of the way, and then inhale that last quarter, that little extra. And that's where our breathing muscles kick in. So we're going to tone those breathing muscles. And then same thing with the exhale. Exhale 3/4 and just pause. And then exhale that extra quarter. And so that we get the transverse abdominis helping with that. The intercostal muscles. So 2-part inhales and 2-part exhales. So one of the most beneficial things for any pain in the body is breath. Even breaths, slower breaths. And that just helps reassure us that things will be okay. Just have to be patient. And so that's the mindful attitude for today, is patience for any aches and pains in the body. Our body is just working stuff out. And so if we can respond with some kindness and gentleness, and also some reassurance for our body, right? It's okay to rest, it's okay to skip a pose, it's okay to do a gentler variation. And having the faith that this too shall pass, these little aches and pains, probably replaced by some other ache and pain. Because we're in the human body and it's aging and it's going to have aches and pains. And so rather than being self-critical or impatient with that, just understanding that it's the human condition. And then we're gonna take a slightly deeper breath and let's give ourselves a big stretch. You can yawn. You can sigh. And just whatever feels good for a few breaths here, waking up to the body that has shown up today. It's a different body every morning, every day. So doing a little scan and just noticing what sensations are percolating up, and noticing, making a note if you have to be extra gentle with a certain area that's kind of speaking to you right now. And really committing to being patient with that. All right, so we're going to do our first pelvic stabilizer. We're going to, first of all, what I'd like you to do is line up your yoga strap on your mat, and I want our toes, we're going to do a lying down bent knee, but our toes are going to rest on the strap, because already a lot of times one foot comes forward because our hips are often not squared. So this is my end game. This yoga strap finishing line is where I want my toes to end. So we're going to start off in bent knee. Bring the shoulder blades in a little closer together. My palms are up. Take a breath here. And can you do a pelvic tilt? So I want you to pull your belly button to the floor. That's a posterior tilt. I can already feel that in my quadratus lumborum. And then I'm going to release it to neutral. And then I'm going to do an anterior tilt where my ribs pop up and my back is overarched. All right, and then I'm going to do that one more time. And I'm going to ask you to drop into sensations. Does one feel better than the other? What does that feel like for your body? And then I want you to find neutral spine. So something in between the posterior tilt and the anterior tilt. That neutral spine is what we're going to try to keep coming back to over and over. So to compensate sometimes for weak muscles, we'll go into a posterior tilt or an anterior tilt. And we're going to try to catch ourselves when we do that and just keep coming back to this feeling of the neutral spine. So I'm going to ask you to take a screenshot of your neutral spine. All right. Next, can you place both hands on your hip bones? Are they aligned as best you can tell using your proprioception? That's your sense of where your body is in space. So I think my hips are aligned at this point. Then I'm going to ask you to lift one knee up fairly quickly and notice what happens to the hip alignment. So I lifted my right knee up and then my right hip moved up an inch. And if I do it quickly, that's what happens. The hips shift. So I'm going to start with my toes on the strap. And this time, I'm going to try to lift one knee really slowly, and I'm going to try to keep those hip bones from shifting. So I'm going to come up, and then I'm going to slowly come back down. And I notice my transverse abdominis is kicking in. And then we're going to try the other side. So let's try to keep those hips aligned without pulling them into the earth, keeping a neutral spine, and just with consciousness lifting the other knee. Now that hip might shift a few millimeters, but as best you can, bringing it up and then back down. Are the toes landing on the strap? All right, so we're just going to alternate. We're going to do two-part inhale coming up, so it's going to be really slow. And then we're going to do two-part exhale coming back down. And just curious to see if we can get our toes to land on the strap. So that's using our proprioception. So I like to keep the hands on the hip bones here. And the idea is how high can you lift your knee before the hips start to shift. So when you feel those hips shifting, then stop lifting the knee. The other thing to think about is that lumbar spine. So remember I talked about keeping that neutral spine. So we don't want to push the spine into the floor, but we also don't want those ribs to flare up and overarch the lumbar spine. So there's so much to be aware of here. And then layer that with the breath. There's no time for the mind to wander here. We've got too much to bring our attention to. And just notice one hip bone might want to push into the floor a little more when you go up. You can solve that by pushing the opposite foot into the floor. So when I bring my right knee up, my left foot can ground a little more so that one hip won't push into the ground. So use the grounded foot as the anchor when we lift up. And that helps the hips from shifting. So we're really trying to isolate the transverse abdominis and the psoas muscles. The psoas muscle is our hip flexor. It's what's allowing our knee to come up towards our chest. We're going to stretch it out later, but this is the strengthening portion. I'm going to do a few more rounds of this. So we're really just trying to build awareness about keeping those hip bones aligned, stable. All right, so finish your last one. And then I'm going to ask you to put a block between your knees. So depending on how wide, I want the knees kind of aligned with my hip bone. I'm really tall. For me, that's the medium edge. Or you can put the thin edge at the top of your thighs, depending on, your size, your hips. But for me, the medium edge between my knees is good. All right. And just squeeze that block a few times. And that's your adductor muscles, right? Those are the muscles on the inside of your thigh that's allowing you to squeeze that block. There's sometimes weak muscles, so we want to strengthen them a little. They're core muscles. They help us balance. Okay, now trying to keep a neutral spine, slowly raising those legs up until we're in a chair pose. All right, what's helping keep us in chair? The psoas muscle, the hip flexor, and our transverse abdominis. They're already working here. Let's place our hands on our knees. And then as best you can, keeping a neutral spine, push the knees towards the hands. The hands are losing the tug of war, and only go as far as those hip bones can stay aligned. And then now the hands are winning the tug of war. They're pushing the knees away until the arms are straight. Now the knees are winning the tug of war and the elbows are bending. And then the hands are winning the tug of war, pushing out until they straighten. Such a small movement, but I can really, almost shaking, I can feel my transverse abdominis. I can feel those hip flexors. So really small movements. Now we can use our 2-part inhale and our 2-part exhale to slow it all down. I'm going to do a few more of those. All right, great. And then let's bring our hands to the floor. Let's take the block away. And we're in chair. And now we're going to dip one toe until it touches that strap and then bring it back up. Now let's put our 2 hands on our hip bones and let's see if we can keep those hip bones from shifting around too much. Trying to keep a neutral spine. So this is the toe into the pond dip. Now, you don't have to go all the way into the pond, right? So you can come down halfway, you can come down 1 inch. So decide, because it's pretty intense to come all the way down, so can you maintain a neutral spine if you bring your toe all the way to the floor? And then, are we holding our breath? Can we work with the inhales and exhales to help support us? And the slower you go, the harder it will be. So just see if you want to challenge yourself to really slow that movement down. The other thing I noticed is my shoulders sometimes kick in, even though I don't need them. So sometimes when things are hard, other muscles want to come to the rescue. But see if we can isolate just the core muscles for this one, and let's get the shoulder muscles out of the equation. All right, and then let's come down and take a break. All right, so next we're gonna go into cobbler. And you can, if you wanna feel like hugging your knees to your chest, so things were contracting, your back muscles were working, so that's why you sometimes feel like bringing your knees to your chest, because your erector spinae and quadratus lumborum is working. It's funny how intuitive the body just already knows how to stretch. Okay, so the next thing we're gonna do is go into a cobbler, but I use cobbler as a stretch mostly. We're gonna use it as a strengthener today. So we're gonna bring our feet together, and we're going to slowly lower the knees towards the ground. The bottoms of the feet are kissing. And just, take a screenshot. Notice there's one hip higher than the other, so that's an imbalance. For me, it's on the left side, the knees a little higher. All right. So I like the palms up, the shoulder blades closer together, shoulders pulling away from your ears. So good posture even when we're lying down. All right, so now, gently pushing the feet together, we're slowly going to close the clamshell, keeping neutral spine. And then at halfway, I'm going to pause and I'm going to take a breath. So I'm gently pulling the feet in towards each other. And you might feel those inner thigh muscles being awakened, and they might even be shaking a little. And then exhale, let those knees drop down slowly. So this is slow like molasses. So we're going to inhale, come up a few inches, pause. Another inhale, coming up a few more inches, pause. And then you're going to play with it. You're going to go down a few inches, up a few inches, up a few inches more, down 1 inch, maybe up 3 inches. So you can make it a little erratic here. You can try closing the knees and squeezing the knees together. We're just going to do all sorts of little things to strengthen those adductors. So you can kind of make it up and use your breath to help guide the movement. Ooh, I notice my shoulders clenching again. So can you scan through and decide, are there any muscles that are trying to help out? And God bless them, but do we really need the shoulders to help? Or do I really need some other muscle to help? Maybe you're clenching your hands or your face. So just see if you can relax the muscles you don't need and focus on the muscles that you do need. All right, you might need a break. Do you want to break in constructive pose? Do you want to break in wide-legged cobbler? If wide-legged cobbler irritates your SI joint, then do constructive pose instead. We're going to take a breath because I'm going to give one more variation here. But let's have a little bit of a recovery breath. So the next one is when the pelvis is 1 inch off the ground, and then we do it all the same thing, but now with the pelvis 1 inch off the ground. It makes it a little harder. The glutes are kicking in, I noticed. And once again, you decide how high up or down you want to go.
And you're just trying all sorts of little movements. So now the glutes and the adductors, the tensor fasciae lata. So there's lots happening. The abdominals. Taking a break whenever you need. All right. A recovery breath here, maybe in constructive pose. So we are going to get to some stretching, don't worry. We're not quite there yet. Next, I asked you to bring a small hand towel. If you don't have one, no worries. But I'm going to ask us to all roll onto our side. And what happens is when we roll on the side, the ribs collapse into the floor. And even for sleeping, it's sometimes good to have a towel under your ribs. If you don't have a towel, you can just do it mentally, like just pull those ribs up so they're not touching the floor. So now it starts, the towel's kind of under my waist, not where my bra strap is, not under my hip bone, but truly like under the waist, all right? Because if we were to, sleeping all night with your ribs collapsed into your mattress can also put some strain on your SI joint. So if you don't have a hand towel, you actually have to work harder. I'm going to ask you to pull those ribs 1 inch off the ground. So let's put a block under our head, or you can use your arm if you want, but I'm going to use my block since it's here. All right. And my legs are out in like 45-degree angles. We're going to do the clam. So we're going to really work the gluteus medius, the tensor fasciae lata, the piriformis, the muscle in our buttock. All right. So let's put our hand on our hip. And is that hip too far back or too far forward, or is that hip truly on top of the other hip? So you're going to have to, as best you can. All right. So now, inhaling that knee up in 2 parts, nice and slow, and then exhaling halfway, and then exhaling completely. The slower we go, the harder our muscles are going to be working. Now we're going to try to keep that hand still. So if the hand starts going forward or backward with the hip, the movement's too large. So it's not about getting that knee high up. It's about trying to move those rotator, trying to move the bone in the socket as minimally as possible. We're going to try to stay aligned with the hips here. Now, if you want to make it a tiny bit harder, you can lift the heel 1 inch off the other heel and continue with the heels very close together, but not touching. Once again, let's try to keep the shoulders out of it, the face muscles out of it, the chest muscles out of it. Let's just focus on that hip area. All right, we can also do circles. Now circles is a little harder because that hip wants to move around a little more. But I'm gonna go slow, and I ask you to go slow. And notice what muscles are working for you. A little gratitude for those muscles. All right, and one last variation we can bring the foot about a foot off the ground, the knee a foot off the ground, and we're just going to do internal rotations. So the knees touch, but the heel stays up. A little bit harder to keep my hip neutral here. I can't quite get the knees to touch without losing my hip alignment. So once again, the heel is about a foot off the ground, and the knee is the one dipping down. Good.
Let's take a break. And I always feel like kind of punching the muscle that's been working just to get it to release. So for here, I just feel like my buttocks were the glute medius and maximus. I'm just gonna tap on them to like get them to release. All right. So this last one before we switch to the other side is the piston pump. So for this one, I'm gonna put, we can put our hand on the floor. So that upper leg is going to come in to our hip, to our chest, and then exhale, flex the foot 45-degree angle. All right, so inhale, and we're gonna go slow. The knee comes into our chest. I mean, you can try putting your hand on your hip if you don't wobble too much. And notice if you bring the knee in too close to the chest, it misaligns, my hip bone then shifts. So we're only gonna bring that knee in as far as we can keep those hips aligned. So you can do a few of those and then decide you've got it. You can put your hand on the floor, or you can continue to keep your hand on your hip bone. I don't know about you, but my glutes are really kicking in here. I really feel them. It's gonna feel so good when we do the figure 4 stretch. Okay, so let's just do one more and then kick out at a 45-degree angle. And let's just inhale and exhale, lower and raise that leg a few times. Burning. Good. Okay, and then you're going to roll onto the other side. If you're comfortable not seeing me, if you want to keep your eyes on me, then you're going to have to spin around. You're going to have to reset that hand towel under our ribs. And get to do it all over again. Now, we're looking for differences, right? Is this hip going to be different? Because this is all awareness, body awareness, useful information. Usually one side's quite different than the other, so let's check it out. All right, so first thing I'm going to do is, I tend to want to get that hip to slump back. So I notice for me, some people might find that the top hip tends to slump forward. So we're just work on really aligning that. The feet are kissing. We're going to inhale that knee up only as far as we can keep those hips aligned. And then exhale, slowly back down, much slower than we want to really go because we tend to rush movements. So nice gooey inhale, nice gooey exhale. Relax the shoulders, the face, the hands, the arms, anything that doesn't need to work. Now, if you want a little more work being done, raise the heel an inch off the other heel, and you have to really kind of focus on not letting that heel move around, because now the heels aren't touching, much easier for that heel to start doing weird things. We want to, as best we can, keep the heels aligned but not touching. Now we're not going to do this today, but if you have a side that's weaker, like my left side is definitely weaker, you would start with the left, then work on the right, and then do an extra round on the left, for example. So it kind of makes sense to do twice the work on the side that's weak. All right, and then remember our next variation was circles, so trying to keep that hip bone aligned on top of the other hips, making those movements extra slow. They don't have to be big, they just have to be slow. And maybe the other way. Remembering to take breaks whenever you need to take breaks. All right, we have the piston pumps to still do, but once again, you might want to just punch out your glute.
And that just kind of gets it to release. Ooh, okay. So the piston pumps. We start with the hand on the hip. The knee comes up to the chest, but only as far as those hip bones stay aligned. And then I'm going to flex that foot and kick out at a 45-degree angle. That gives me a hamstring stretch too, a calf stretch. So I like to exhale when I come up and inhale when I kick out, but you can do it the other way around, so play with that. So the breath keeps it slow, because the slower we go, the harder we're working those muscles. Let's do one more together, and then we'll do the pulses. So we're just gonna kind of pulse up and down here. And you can really feel that. Wow, our legs are heavier than we think. You really feel that gluteus maximus and medius. Oh, working hard for us. Thank you. Butt muscles. All right, we're gonna stretch now. So this is the main course. We get dessert now. Stretching is the dessert. Let's move that towel away. We can move the block under our head. All right, so we were contracting those butt muscles, the piriformis, the glutes. So now we're gonna give them a bit of a stretch. So once again, let's lie down. Let's have our feet aligned. One foot often wants to lead. So I start with my feet aligned, toes touching, and then I Charlie Chaplin my feet out, and then the heels come out. So that means my feet are aligned. I don't know if that was clear or not, but all right, now, ooh, this is hard. I'm gonna have both my hands on my hip bone. I'm gonna slowly raise that leg and cross the ankle over the knee without shifting the hip bones. You have to do this really slowly, it's hard. And then pushing that knee away from my chest, but keeping the hip bones squared. To do this, we have to go oh so slow. Okay, so I'm already feeling a bit of a stretch here. I can stop here. Or trying to keep a neutral spine, slowly raising the other foot off the ground. And so you might notice a stretch to your buttocks. You can hold here. If you don't have SI, I would hold here if you have SI pain right now, or acute pain, or you're going through a flare-up, because the next one can misalign your SI joint. So the next one is kind of interlocking the fingers behind the thigh and pulling that thigh closer, but the bent elbow pushes the bent knee further away. So the hands are pulling one thigh closer, and the bent elbow is pushing the bent thigh further away. All right, so that's a deeper stretch, but only do it if you're really confident you can keep the hip bones aligned. Taking a breath here. I like to flex my feet here because the knees like that usually. Now you can be static, or you can, if you don't have SI joint pain, you can shift around, make little circles one way, little circles the other way. But if you're in an acute SI joint flare-up, I'm just not wanting you to get asymmetrical here, which we can sometimes do when we move around in the pose. So static or playing a little, your choice. A few more breaths. And then slowly coming back down, putting your hands hands on your hip bones, and as you lower that leg, keeping those hip bones aligned. It's a very slow class. We're really working on alignment. All right, now the other side. So one foot grounds into the floor. That will help stabilize as the other foot crosses over the knee, opening the chicken wing, external rotation. The hip bones really want to shift for this. Taking a breath, hip bones squared, spine neutral, and then slowly raising the other foot off the ground or not. So if it's going to misalign your sacrum, then keep that foot on the floor. You're still getting a good stretch. This is bus stop 2. Bus stop 3 is weaving the hand underneath the thigh. The other hand joins. You see, on this side, I feel the SI joint. So I'm going to go to bus stop 2 for this side. So choose your bus stop accordingly. What's going to make that? So if you're getting any twinging anywhere in the pelvis, going back to an earlier variation. Conscious inhales and exhales here. 2-part inhale, 2-part exhale. And then on the next exhale, slowly coming out of it, trying to keep those hip bones aligned, trying to keep the spine neutral. We're going to go to tabletop, and I'm going to show you kind of the best way to get into it if you have for a perfect alignment. So let's bring our knees together. Let's bring our ankles together. I often do a spinal rock to get into tabletop, but that's contraindicated if you have SI pain. So now I'm going to roll over to my side with the knees and ankles touching the whole time, which is a little harder than I thought it would be. All right. Now I'm in Baby Krishna, and I'm going to push one hand into the floor and get myself up, still keeping those knees and ankles touching. Great. And then we have to get ourselves into tabletop. So when rolling to the side, if you have an SI joint pain, you really want to focus on keeping those knees and ankles touching, pelvis aligned. Tabletop. Okay, let's just talk about spine here. If I collapse my lumbar spine, I feel it in my SI joint. I'm really collapsing here. This is my lumbar spine, right? I can now feel it in my quadratus lumborum. And then, so this is an anterior tilt of the spine. Now we're going to do a posterior tilt where the belly button pulls up to the sky and I'm tucking my tailbone under. And I feel this on my quadratus lumborum a little bit too. It kind of feels good in my upper spine though. Okay, that's the problem. I want this stretch in the upper spine, but not the lower spine. So let's put one hand on your lower back, like this. All right, we're gonna try to keep that hand neutral. We're gonna puff up the chest, stretch out our upper spine, keeping that hand neutral. And then we're gonna curl the upper spine up into cat pose, keeping that spine neutral. And come to tabletop, put your hand on the floor. So pretend you have a water bottle here on your lower spine and you don't want it to roll one way and roll the other way. So let's try to keep that lower spine neutral. And we inhale into cow, it's through the chest. And when we exhale into the cat, it's through the upper spine, the thoracic spine. So keeping the lower spine neutral, doing some cats and cows. I like to inhale into cow, exhale into cat. Good. So just focus on the upper half of the spine. Next, let's put a block, middle edge between our feet, and our knees are aligned. Our feet are wrapped around that block. We're going to go from tabletop into
child's pose. So we're going to walk one hand 6 inches forward, the other hand 6 inches forward. On the exhale, the hips sink towards the heels. They might not touch the heels, and think about those hip bones. Are they aligned? Are they aligned? Are the knees, is one knee wanting to slide forward or backward? And you might not get the hips all the way to the heels, especially if you have knee issues. And then you're going to inhale, come back up, and you have the option of going into a half plank. If you have no SI joint issues, you can drop the hips down and go into a knee supported upward dog. And then come back into tabletop. Slowly bring the hips towards the heels. They don't have to go all the way to the heels. So we're stretching out our back muscles here. So this is kind of half child's pose, half downward puppy. And then inhale to tabletop. Come into a knee supported plank, or dropping the hips even more, looking forward. Back is gently arching. We're in an upward dog here, but a knee supported upward dog. That's it. So play with that a few times. And this is the stretching portion. So we're stretching our lower back muscles. Now, one other variation. If this is triggering your SI joint or bothering your knees, you can do full out downward puppy, which I love. That's on tabletop. One hand comes forward, the other hand comes forward, and my head sinks towards the floor, my chest sinks to the floor, my hips are over my knees. I'm not playing with my pelvis at all. I'm keeping it very still and neutral. So that's another option for some of you. So once again, if this movement is twinging anything in your lower back or your spine, downward puppy is your pose. All right, and then we're gonna get onto our belly. So I'm gonna show you one way to get onto your bellies, but you can get onto your belly any way you want. I am in a child's pose. I'm gonna drop onto my elbows. I'm gonna slither through onto my belly. And I am into a cobra. Oh, you know what? I always forget to tell you this. Can you put a block between your feet? So we're gonna put the block like this. Medium width is probably good. It's between your feet or between your calves. All right. And we're going to play with Cobra. So I want to strengthen our back muscles. So people with acute sciatic pain, you might want to skip this or just so minimal, right? So we're going to do it in stages. We're going to bring our hands to our chest. We're going to squeeze the block with our feet and engage our buttocks. Squeeze your butt cheeks, all right? And then we're just going to inhale, come up an inch. Exhale, come back down. The elbows squeeze together as we inhale up an inch, exhale back down. Now, maybe you can squeeze up higher, 2 or 3 inches, but we don't want to use our hands here, right? We want to use our buttock muscles. So once again, if you had an acute back flare-up, you might want to skip this one altogether. All right, now we're going to test out the bottom half of the tail. So keeping the chin on the floor, inhaling that block up 1 inch, exhaling that block down. How did it feel? Did it feel okay or not? Because you can just work on the top half of the body, or we can bring the chest and the feet up at the same time. Not using our hands to push into the floor, really trying to work the buttock muscles and the back muscles. So inhale, squeeze the buttocks, squeeze the block with the feet, come up a few inches, exhale, back down. Try a few rounds of that. Anything is twinging, you're gonna skip it. And so we're going to try to keep those legs straight. So rather than bending the knees as we come up, I only want the feet to come up like 1 inch off the ground. So try to keep your legs straight. And then the feet just come up 1 inch. It doesn't have to be a lot. All right, I'm going to give a variation now. Hands stay at the chest. And now the feet go wider. They're kind of like at the edge of your mat, of either mat, all right? So we're gonna do the first half again, squeezing the elbows together, pulling the shoulders away from the ears. All 10 toes push into the ground, engage the buttocks, and inhale, just the chest and chin come up an inch or two, and then exhale back down. Once again, elbows pull together, shoulders away from the ears, toes press into the floor, buttocks engaged. Inhale, the chin up a few inches, exhale back down. All right, do you want to throw in the legs or not? So inhale, the chin and the legs come up, and imagine energetically pulling those legs towards each other, but they're not moving. And then exhaling back down. We'll do that a few times. Keep trying to pin those elbows right towards your ribs. And so not cranking the head back, so looking at the floor. I like a neutral neck for this. Squeezing the buttocks, pretending to squeeze the legs together, coming up a few inches, and then exhaling back down. All right, you can break, or if you want the final fun, if you have no back issues and you're like, my back's fine, I want more, you can scissor the legs. So you're coming up with the chest, your legs are wide apart, and then you squeeze the legs together and then bring them back apart. So you're scissoring those legs in and out. And really, my chin is about just 2 inches off the ground. It's not very far off the ground. Use the breath, go slow, squeeze, and then bring the legs further apart. Any twinging in the lower back, you're gonna stop immediately, right? You get to stretch. Now's the dessert. So before we even go for dessert, let's have what is the sorbet they serve between meals? We're going to clear our palate. So I'm just going to have you rest, recovery breath. One hand over the other, resting your cheek on your hands, bringing your heels up, and just kind of windshield wiping them side to side. And the windshield wipes can be really small. If you have any SI joint sensitivity, they're really small, or you're not doing them at all. So the second there's a twinging, we stop. Oh, you see, if the move, for me, if I move to 45 degrees, I get a twinging in my SI joints. So I'm gonna make it really small for me. The other thing is to like shake up the shoulders. So you don't have to do the windshield wipers at all. I also love just shaking up my shoulders here and then just nestling into the mat. And taking a few belly breaths and just feeling that belly gently push into the floor on the inhale and release on the exhale, and that helps with digestion and massages the internal organs a bit. All right, in your own time, you're going to come up into tabletop, and we're going to do one interesting stretch for me. So the hands are at the chest, you push your hands into the floor and come into tabletop. All right. So this is an asymmetrical stretch. For some people with SI joint pain, this feels good. For other people, it doesn't feel good. So see how it goes for you. Remember, for SI joint pain, often downward puppy is your stretch, right? Because my pelvis is completely aligned. There's no asymmetry, downward puppy. So that can be your go-to if this doesn't work. But let's try it out. We're in tabletop.
We'll do one baseline one. Our knees are aligned. We did this before. We just slowly sink our hips towards our heels. Make sure the pelvic bones are aligned. One wants to slide forward on me. I'm feeling that stretch in my lower back, and then I'm going to come back up to tabletop. That's my baseline. How did that feel? Right here, this is how we're going to make it different now. One knee is going to slide back 2 inches. Pick a knee. All right, the feet are aligned, so try not to let the ankles drop to the side or to the inside or whatever. So we want all 10 toes on the floor. The tops of the toes are on the floor. Okay, now one hand walks forward a little, the other hand walks forward a little, and now I'm slowly, ever so slowly, going to sink those hips towards my heels. And notice where you feel it. Like, I really feel this in one hip right now, so I'm going to stop. I'm going to take a few breaths, and I find if I take a few breaths, I can come down another inch or so. So this is a big stretch to one side of your back more than the other. It can feel good or it can not feel good. Doesn't feel good, you're going to go into downward puppy stretch or something different. All right, let's try the other side, just because, you know, it's cool to see how one side is different. We realign our knees, and now the other knee slides back 2 inches. Feet, are they parallel? All 10 toes on the floor, not letting the ankles drop to one side. All right, so slowly, ever so slowly, keeping those hips squared as best you can. I mean, one hip's a little forward, but slowly going down. And then I find I hit a point where I just don't want to go anymore, so I stop, I take a few breaths, and then I find I can go another centimeter after I take a few breaths. So for me, the key to this one is just going really slowly into it. And then coming back up to tabletop. So I really love this stretch, but I have to go into it very slowly. But if this stretch is not your jam, then take it out of your repertoire. We have one more pose to do before we land the plane, as I say, and that is a forward lunge. Now, if you have 2 blocks, this will be great. So get your 2 blocks set up. If you have 2 books, you'll have to use the lower edge. Otherwise, if you have blocks, you can use the higher edge. We're going to do an active lunge, not a passive lunge. So one foot is going to come forward very gently, wiggling those toes forward. The knee is over the ankle. My hands are on the blocks, and then I'm going to curl the back toes under and slide that knee back until my psoas says, hey, that's enough. Now what's happened is this hip is way forward. So think about the foot that's forward. I bet that hip is way forward. I'm going to ask you to pull that hip back and align the hip bones as best you can, right? Because that hip wants to slide forward so badly. All right. Then I'm going to ask you to curl the toes under of the back foot, and I'm going to ask you to straighten that back leg. And then scissor the legs in. So the front thigh bone is pulling back, and the back thigh bone is pulling forward. So we're squaring the hips. You can stay here, or you can put one hand on the knee, the other hand on the knee, come up a little higher. Scissoring the legs in, scissoring in, scissoring in. Because I really want to strengthen these muscles, not just passively stretch them. So we're stretching that psoas, but we're also strengthening it at the same time because it's scissoring in. All right, final option. One hand goes out, the other hand goes out. This might not feel right. You can put your hands back on the knee. You can put your hands back on the block. Let's take a few breaths, scissoring those legs in. Wow, things are working hard here, huh? All right, and then slowly bring the hands to the floor, dropping the knee, uncurling those toes, bringing that foot back, maybe doing a little bit of a downward puppy stretch or a child's pose here before we do the other side.
Everything's slow motion today. The other foot slowly comes up. Knee over ankle. Deciding how far back that back knee is going to go. Squaring the hips. That left, this time for me, it's whatever hip is forward pulls back. All right. So if we just stayed here, this is a passive stretch. I'm stretching out my psoas, but I'm going to strengthen as I stretch. So I'm going to curl those back toes under, lift that knee up, and scissor the legs in. That means the front thigh bone pulls back and the back thigh bone pulls forward. So now muscles are working a little harder. Hold here or come out of it, or put one hand on one knee, see if the other hand wants to come up. You can hold here. This can be your bus stop. Scissoring those legs in. Or arms come out at a 45-degree angle, pulling the arms into the sockets, pulling the thigh bones into their sockets. So we want to pull bones into their sockets because that stabilizes the joints. So arms pull into their sockets, thigh bones pull into their sockets. This is stability. Taking a few breaths here. And then when you're ready, slow as molasses, coming out of the pose. And going into child's pose or downward puppy. I'm going to do downward puppy. I like to put my forehead on a block for downward puppy. Pushing the hands into the floor will give you a shoulder stretch. The hardest is behind us. Just going to do one or two more stretches and then we get to do Shavasana. So we're on our hands and knees. Bring your knees together, our ankles together. We're going to try to symmetrically come onto our buttocks and then swing around and lie down nice and slow, thinking about pelvic alignment all the time. All right, So let's give ourselves a final stretch. I'm going to ask you to grab the strap and let's put the strap around the ball joint and slowly bring our leg up. But let's think about those hip alignments because sometimes when one leg goes up, that hip slides forward. So I've got my right leg up, my right hip slid up an inch. So I'm going to pull that right hip down. And it means I can't get my foot up as high. So a lot of times we misalign ourselves because we have this goal of like, I want to get that foot right up to the sky, or, I want to be more flexible. So, but not at the sacrifice of alignment. So just think about, are your hips aligned? And that maybe means not getting the foot up as high. And you can also bend the knee, by the way. So it doesn't have to be a straight leg. Let's breathe into that hamstring. This is dessert time. Slowing down the breath, and then the heart will slow down. So you can hold here. This is a little asymmetrical, so if you have SI joint pain, you might not want to do this. Slowly floating that leg open to the side. I'm really pressing into that hip bone though, so I'm going to try to push the other hip bone down a little. Landing on the elbow with the choice of putting a block under your thigh to make it a little more relaxing and passive, stretching out the adductors. Once again, I notice one hip is really coming off the ground, so I'm going to try to pull it back down, which means I have to go to the higher level of the block, no problem. So just playing with it or not using the block at all. We'll take a few breaths here. And then on the inhale, using those adductor muscles to get the leg back up. Switching feet. Lowering the other leg ever so slowly. Now once again, is one hip bone jutting up. So I'm on my left side, so my left hip has just gone up an inch. I'm going to pull that left hip down towards the bottom of the mat. I'm going to realign my hips. So much to be aware of. All right. You can be static. You can do piston pumps by bending that knee and straightening it a few times. It's up to you. Maybe relaxing the opposite leg. In fact, how about relaxing everything except the arms, because they gotta hold the strap. And the final option of letting that left leg float, or the right leg, whichever one you have up, that leg floats to the side. And notice how I notice my whole body torqued to that side. So I'm gonna, using mental telepathy, really try to ground the other hip into the floor, not get that leg as far down. Right, but we don't want that shearing to happen in our pelvis. Now the other thing to do would to also be put a towel under the back hip bone that's pressing most into the floor. So the other little trick is to put a towel under that hip bone. Whatever leg is coming out to the side, that's the hip bone that really wants to push into the floor, so you could put a towel under it. And then one more breath. Inhaling the leg back up. And then deciding what is the last yoga pose you would like to do. Your choice, yogi's choice. What would feel good for you? So you have a choice for Shavasana. Last week we did Astronaut Pose, if you have a chair handy. If not, then I would suggest you do Constructive Pose. So Constructive Pose is the knees, feet are at the outside edge of the mat, and the knees collapse in towards each other, and the arms are at an A-frame. So that usually feels good for the sacrum. The other thing that feels good is Astronaut Pose, where you put a strap around your thighs so that your knees are hip width apart, and then you rest the calves on the chair, and the arms go however they want to go. So this is Astronaut Pose. And then I also you can put a block between your knees and the strap if you want, and that stops from the knees from collapsing in towards each other. A lot of options, so choose something. Or you can just do regular Shavasana if that's what you prefer today. Bring the shoulder blades in a little closer together for good posture. Tucking in the chin ever so slightly to get some traction in the back of the neck. And how about a big sigh? You made it. And no more breath manipulation here. Now we're just going to do natural breathing. What is your natural breath right now? What's shown up for you right now? And maybe a gentle smile on your face. If we smile, it actually tells our brain that things are all right and that we're happy. And feeling the eyes smile, the corners of our eyes make little smiles too, perhaps. Our jaw relaxes when we smile. This is just a gentle smile though, not a big smile. A smile of contentment. And then feeling that smile descend down into our shoulders. Our arms, our hands are making smiles when our palms are cupped up towards the sky. Can you feel your heart smiling? Feel your belly smiling. The pelvis, feeling the pelvis smile. And the smile melts into our thighs, our calves. And then finally the feet are smiling. Maybe even coming back to the sound anchor that we started with. Are you aware of any environmental sounds floating up? The sound of your breath, maybe. Holding it all in awareness. And then we're slowly going to get ourselves into Baby Krishna and just try to remember we talked about having those knees and ankles touch and together in one slow movement coming over to the side. As best we can, keeping our hips aligned. Maybe a hand under the head to act as a pillow. And a few more breaths in Baby Krishna as I read our poem out for today. So this poem is called Instructions for the Journey by Pat Schneider. The self you leave behind is only a skin you have outgrown. Don't grieve for it. Look to the wet, raw, unfinished self, the one you are becoming. The world too sheds its skin. It's easy to lose this tenderly unfolding moment. Look for it, as if it were the first green blade after a long winter. Listen for it, as if it were the first clear note of the sparrow in the spring. And if all that fails, wash your own dishes, rinse them, stand in your kitchen at your sink, let cold water run between your fingers, feel it. Then try again, looking to the wet, raw, unfinished self, the one you are becoming. Slightly deeper breath, ready to awaken to the rest of your day, maybe stretching up one arm to the sky and then lowering it and gently pushing it into the floor, coming into a seated pose. Let's bring our hands to our heart, making a flame pose or a lotus or a heart. And just checking in with ourselves. How are we feeling physically right now, emotionally, mentally? Comparing now to the beginning of class. And let's inhale up to the sky. And as we slowly unfold into our new self, because we are a new self moment by moment. Bring your hands back to our heart. Big bow to the pelvis, to the sacrum. Thank you, pelvis. Thank you, SI joint. Thank you, core muscles. They worked hard for us today. And that's a wrap, guys. Thank you for coming to class.